foramen stylomastoideus. This from geniculum, in geniculum located ganglion geniculatum. This what you can see if you ganglion, it is then located nucleus. What nucleus? In this start from nervus petrosi major. This is nerve exit through the pyramid and exit. Then exit through the hiatus nervus petrosi major. Then this nerve continues and pass through the foramen lacerum. Foramen lacerum. This you know, this is behind body and pterygoid process of the still that is sphenoid bone, located canalis pterygoideus. A canalis pterygoideus open in fossa pterygoideus. In fossa pterygoideus located ganglion pterygopalatinus. Fossa pterygopalatinus, this is located ganglion pterygopalatina. A ganglion pterygopalatina connect with nervus maxillaris, nervus trigeminus. Поэтому this is nerve parasympathetic. Understand? Yes. Next nerve, what this is, you can see, смотрите, nervus, what you can see, nervus petrosi. Вот он, где тут у нас, это нет, это, вот он, где-то Петроси. А next nerve, nervus stapedius, innervate muscle stapedius. This is next nervus tympani. Хорда тимпани. Oh, you know canalis. Хорда тимпани это фосса петроси. Фос, там, как у нас фоссула петроси. Петроси. Between canalis caroticus and foramen jugularis. Это first semester. Это you must know. You have exam. You have mark. Anatomy exam. Or delete exam. Anatomy. No, delete. Horda tympani. Этого horda tympani connect with nervus lingualis of the nervus mandibularis, a mandibularis branches nervus trigeminus. Поэтому this is nerve innervate tongue. Это
1/3.
Да, tester.
Yes, what?
Sensitive. 2-3 part anterior. 2-3 part anterior. Так, next. This is 3 nerve start from internal. In canalis, поэтому because name internal branch. Then this nerve exits through the foramen stylomastoid. What you can see.
Second one is trapezoidis.
Stapedius. What you can see, да, он такой small muscles там, small. This is, you can see foramen, what you can see branches. Вот они, 3 branches. This name это nervus auriculus posterior, this acousticus meatus, видите, posterior auricularis, and this 2 temporal. No, this different maybe, значит, occipital posterior, innervate muscle occipitalis posterior belly, да, this is frontal. This is это occipital frontal muscle. This is digastrica, brachiodigastrica. Innervate musculus digastrica posterior belly. Вот 3. Вот you can see nervus facialis, вот continuous, видите, continuous. Вот он, nervus facialis. Вот. And go to parotoideus. Pass through the canalis parotoideus. Don't innervate this glandula. Потому что because nervus facialis innervate another glandula. Glandula lacrimalis, submandibularis, sublingualis, salivatorius, да, там, minor and other, да. And this is tunica mucosa, oral and oral and nasal cavity. Mucosa tunica. This is, you can see, this is bundle of this branch named pes anserinus major. Intraorbital forms pes anserinus minor. This is from pes anserinus major. Yes? This is from branches temporal, zygomatic, buccalis, and marginalis mandibularis. Understand? Yes. What you can see branches. This is, I ask you, muscles which innervate by this nerve. Ну, cervical, вот она. Там, здесь, вот тут у меня. Вот, вот cervical. Вот она. Здесь брейк. Поэтому она у меня здесь. Да, вот you can see, вот она, рамица листами. Connect nervus transversus coli. Nervus transversus coli name. Connect and form ansa cervicalis superficialis. Connect plexus cervicalis and cranial nerve. Yes? Yes. Next nervus. Nervus vestibulocochlearis. What you can see. Vestibulocochlearis. No, you must know. No, in textbook write. This nervus vestibulocochlearis exit from brain. Nervus facialis. Brain. No, but you must know. We can write in textbook exit from brain. No, this is you must know. Don't exit, I won't enter. Why? See. No, you can answer how write textbook. No, you must know. What you can see, this is cochlear organ, это vestibular organ of the internal ear.
Internal ear.
Yes. You can see into, in this organ, sensory cells is epithelial cells. Neural cells located in ganglion. Поэтому what you can see ganglion and spiral organ, and this is vestibular ganglion. The spiral ganglion, vestibular. Значит, if you saw это sensory cells, axon of the cell form cochlear part of the vestibular, этот cochlear nerve. This is axon form vestibular part. This is together part vestibular. What you can see internal meatus, what you can see, this is from exit from pyramid. Vestibulocochlearis is this nerve enter in brain. Understand? Поэтому in brain located nucleus vestibularis and cochlearis. This is, you can see this what four vestibular, this is auditory. Anterior, вот здесь какой вот superior, lateralis, medialis, lateralis, and it's anterior and posterior. То есть это only sensory nerve. Understand? Understand. Next, nervus glossopharyngeus. Nervus glossopharyngeus has three nucleus. Nucleus ambiguus, nucleus salivatus, solitarius. Так, подождите, вот, give me. Значит, this is three nucleus form nerve glossopharyngeus. Вот он glossopharyngeus. Exit through the sulcus posterior lateralis. This is nerve. Then exit through the foramen jugularis. What you can see foramen jugularis. What this is ganglion. What this nerve has two ganglion. What two ganglion. Superior and inferior. In space foramen located superior ganglion, below located inferior ganglion. This is ganglion projection near ear in this projection. This is nerve downward through the foramen jugularis and located between Name this vein.
Superior vena cava.
Where name vein?
ये वो है
Name vein.
jugular vein internal
No, name vein which exits through the foramen jugularis.
Jugular vein.
Vena jugularis internal. But on neo located arteria caroticus internal. In between located nervus glossopharyngeus. Потом laterally you can see located with nucleus of the vagus. Тоже projection in this вот. Projection. Поэтому пад. Вот this is glossopharyngeus ganglion and the nervus vagus. Understand? Поэтому this nerve downward and innervate organ which located at this pharynx. Pharynx. Pharynx consists three parts. Name part.
Nasopharynx, laryngopharynx, and oropharynx.
Поэтому this is not innervate this group muscle, and this is located tongue, and soft palate. Yes. What you can see, значит, вот он nerve. This is nerve continuous and innervate still on pharyngeus muscle. Потом branches innervate tongue. Это posterior part 1-3 parts. Posterior. This another tonsillar branch. Innervate glandula tonsilla palatinus. And this you can see many branches pharynx. In the form plexus pharynx together nervus vagus. Innervate muscles of the pharynx. And another nerve, what you can see, nervus, это branch или rami carotid sinus, which located between, это arteria caroticus communis, видите, bifurcatio, это internal caroticus, это external, это internal. This is located, вот это, this is sinus, well located, это glomerulus caroticus. Это special group neural cells. This is maybe cells of the cancer, sometimes, maybe. But this is a special group neural cells. What you can see branch. Это nervus glossopharyngeus. Next nerve, nervus vagus. Nervus vagus. Nervus vagus.
longest
Nervus vagus. Где у меня тут? Давайте together. Red or green?
Red, professor.
Red?
green
Black.
Your favorite, professor.
Black.
Your favorite.
Green?
Your favorite color.
your favorite color
Ну ладно. Ну, maybe. Ладно. Значит, итак. Значит, this is nervus vagus. Has two ganglia. Superior, inferior. Значит, this is nervus has next part. Cranial, cervical, thoracic, abdominal. Why? Very simple. Вот this is, you can see projection. This is located ganglion. Это left, right. This is nervus downward, and the pass. This is through the foramen jugularis. Continuous near nervus glossopharyngeus. Then this is part name cervical. What you can see это larynx, trachea. This is cervical. Значит, это у нас будет что? Cervical part. This cervical part. Nervus vagus enter into thoracic cavity through the aperture thoracic. Aperture. Значит, this is if you left nervus vagus. This is nervus pass between arteria caroticus communis and arteria subclavia left. Right vagus pass through the pass into this is thoracic aperture between arteria subclavia and vena subclavia. And this is two vagus enter into thoracic cage. You know thoracic cage, what you can see. This is, you know, это larynx, trachea. This is located behind, this is posterior mediastinum. Where located, what you can see, root of palma. И поэтому this is nervus downward near root, where form branches. This nerve continues and form plexus esophagus, then pass through the diaphragm and form abdominal part. Поэтому because this is nerve has next part. Это cranial part, потом cervical part, thoracic part, and abdominal part. Abdominal part, а это cranial part. Значит, in this in cranial part, this nerve has two branches, meninges and auriculus. No, auriculus you understand, да? Да, this is auricle, innervate skin of the acousticus, да, external. This you know posterior crani, да? The fossa crani posterior, where located dura mater, innervate this dura mater and innervate sinus transversus and occipital. This is next from cervical part, from ganglion, start from rami pharynges. Вот это rami pharynges. Rami pharynges. This is rami pharynges. Это together, значит, pharynx, nervus pharyngeus, rami pharyngeus of the glossopharyngeus. Form together form plexus pharyngeus, together with nervus glossopharyngeus. Next nervus